Lower limb injuries. Common lower limb injuries include bulging and herniated discs, knee meniscus injuries, and heel fractures. Bulging disc. Lower limb injuries include a bulging disc, where the disc bulges out like air coming out of a tire. The covering disc is ruptured and it compresses the nerve, which causes pain. Herniated disc. A herniated disc, on the other hand, is more severe in that the outer covering of the disc has a hole or tear. The nucleus pulposus, or the central jelly-like substance of the disc, starts to leak out into the spinal cord. Herniated discs involve leaking. Causation. The cause of bulging or herniated discs includes trauma, aging, genetics, poor posture, repetitive movement, poor lifting technique, a sedentary lifestyle, contact sports, and is often linked to occupation. Symptoms involved include sciatica, which is a sharp, shooting pain that runs to the leg. There is numbness, a tingling sensation in the leg and foot, and weakness in the leg or foot. And in some cases, there is a possible loss of bladder or bowel control. The prognosis of bulging and herniated discs is expected to be 3 to 4 months. Sometimes a scan can pick up this issue even when the individual has no symptoms. Treatment. Usual treatment includes conservative physiotherapy, steroid injections, and NSAIDs, which could take up to 3 months. If this doesn't work, then surgery might be considered. Treating providers need to look at trade-offs between function and pain reduction because sometimes surgery is not the one-fix-all solution, and the treatment can be a long process. Surgical treatment includes foraminotomy and laminotomy, which involves cutting part of the spinal column bone, but results in less stability. Discectomy involves cutting part of the disc itself. Lumbar fusion is the use of plates, rods, and screws to fix a disc in place, which helps to stabilize, reduce movement, and reshape the spine for a better curvature, protecting the disc. Lumbar fusion requires a 6 to 12-week prognosis, and physiotherapy can commence from 6 weeks to 3 months after surgery. This is further supplemented with medication and pain management. Patients can commence sedentary work in 4 to 6 weeks, and light physical labor in 3 to 6 months, adding plates to stabilize the vertebrae or disc. Knee meniscus. The next common injury is a knee meniscus injury, which is usually caused by forceful twisting or rotating of the knee when one is putting their full weight on it. Aged individuals tend to have worn tissues and thus are more prone to tears. Symptoms include pain, stiffness, swelling, locking of the knee, and the sensation that the knee is going to give way, preventing the knee from moving through the full range of motion. Knee meniscus. Injuries can vary. Partial versus full tear depends on how large the tear is, and it is up to the specialist to recommend a knee replacement. Common treatment options involve NSAIDs, steroid injections, platelet-rich plasma, PRP, physiotherapy, and the RICE protocol in resting, icing, compressing, and elevating the sore area to alleviate pain. Surgical treatment options include knee arthroscopy, partial meniscectomy, which has a 3 to 6 week recovery period, and meniscus repair, which typically involves 3 to 6 months of rehabilitation. Calcaneus fracture, heel fracture. The final common lower limb injury includes a calcaneus or heel bone fracture, which is usually treated through immobilization in a cast or moon boot for 6 to 8 weeks. Surgical treatment options such as percutaneous screw fixation, open reduction, and internal fixation, ORIF, are used. Rehabilitation includes physiotherapy, which involves education, swelling control, scar management, early range of motion, strengthening supporting muscles, weight-bearing and partial weight-bearing activities. Partial weight-bearing usually lasts for 6 to 10 weeks. Summary. In treatment, we need to set up the mindset that pain is expected, but there is improvement over time. We use reassurance and counseling to ease the patient and reiterate that it is hard to return to a pre-injury level.